Hi there, I'm Dr. Constance Wong, and today I'm going to talk about a common dental misconception with regards to children developing dental decay. So I have seen and treated a lot of children with decay, and parents have been told by previous dentists, or they have this belief that their children's teeth or the enamel is really weak, so that's why they develop decay. And my mum was told exactly the same thing as a child when I needed fillings. I ended up needing fillings when I was about 4 or 5 years old on my baby teeth, and I actually needed gas to actually treat me, so it was quite a big deal. And I've still got the baby teeth, and looking back now that I'm a dentist and I have more knowledge, I turn to my mum and say, I didn't have weak teeth, mum, I had decay. So yes, you can get disorders where the enamel doesn't form properly on the teeth. So for example, there's something called enamel hyperplasia, and a small percentage of children do have this, and yes, they are at more risk of getting decay, but it doesn't mean that they're 100% definitely going to get decay. So you're more likely to have decay than to actually have weak teeth. Parents are adamant that their kids don't have snacks, or they don't give sweets to their children, or they only have healthy snacks like fruit. And I can empathise with them because my parents felt the same way too. But my downfall as a child was that I was a grazer, and I didn't like the thought of having a snack and then finishing it and thinking, oh, I don't have a snack left. So I never used to eat things in one go. I used to kind of have a tangerine or a packet of sweets or something, and I would nibble at them, have a couple, and then hoard them and save them for later. And my parents never realised that, so they never thought it was a problem. So I can completely understand that, of course, everyone wants to be a good parent. You don't want to come across as a bad parent. And dentists find it difficult to tell patients that actually they're wrong in thinking that this misconception is true. And we don't want to accuse parents of being bad parents. No one likes to be told that their children have decay because they're actually being fed snacks that causes them to have the dental disease. So how do you tackle this? So I've got 3 top tips to give parents with children. Number 1, if you do give your children a snack, make sure they have something savoury, such as cheese or vegetable sticks, rather than something sugary. They're less likely to get decay if they're having something savoury. Things like dried or fresh fruit, you might think that's healthy, but actually they're really, really concentrated with a lot of sugar. So if you can, try to avoid those sugary snacks. Number 2, if you're going to give a child a snack, make sure they eat it all in one go and in a short space of time, and that they don't end up hoarding it and saving it for later like I did as a kid. So I'm talking from experience. And then number 3, make sure that your child has regular dental checkups. There has been recent analysis showing that 80% of 1 to 2 year olds didn't visit an NHS dentist in the last year, despite our dental recommendations of a child seeing a dentist as soon as the first tooth comes through. So if we can catch problems early, then they won't progress to major problems such as having fillings under gas, as I did when I was a child. So that's my advice for today. Thank you for watching, and if you enjoyed the video, I'd appreciate any likes or feedback, and if you have any questions or comments, please leave them in the comments section. Also, don't forget to share the video if you think your friends will like it too. Next week, I'll talk a bit more in depth about dental decay and caries and what factors are important in developing decay. If you have any specific questions you'd like me to answer, leave a comment and I'll mention it in the next video. Otherwise, I hope you all have a lovely day, and I'll see you same time next week. Bye now.